So the transition process begins early on in life. The 5 and 6-year-old comes in, and the pediatrician, instead of addressing the parent and asking the parent question, can start asking the 5-year-old questions. How's school going? Do you have friends? Are you getting do you have headaches? Do you have stomach aches? Do you have any questions today? And so you're sending this message that this is your appointment, and you can be responsible for asking questions and answering questions, and your parents will be here to help you. And then as time goes on, 12, 13 years of age, the child comes back, or the youth comes back by themselves without the parent. And they assume more and more of the responsibility, and they have more and more privilege because they have confidentiality then by 14 and 15 years of age. So then they can just well as an adult, and they can speak to the provider knowing that everything they talk about is confidential. And during that time, the pediatrician's role would be to ask questions that assume responsibility for care. So, what medications are you taking? What do you understand about your special need? What can we do to help make your transition better? How can I help to educate you more about things? What community resources are available that you've used? Are there community resources out there that I can help you find? What area of your life would you like to change? What's your #1 goal? All those kind of questions asked to the youth can help them to start to take on responsibility for some of their care. In addition to that, in a more formal way, a healthcare summary or a transition summary can be created. And that transition summary would include specialists and medications, previous hospitalizations. It'll include where do you go to school, what are your goals, what are your vocational goals, and healthcare summary becomes a document that's living and changing over time and really represents who the youth is, not only what their special need is, what their medical care involves, but who they are as a person and what their goals in life are. And we can then help to transition this individual to the adult care providers more thoroughly than just transitioning someone's health care to an adult care provider.